Doctors with disabilities exist in small but measurable numbers. How did they navigate their journey? What were the challenges? What are the benefits to patients and to their peers? What can we learn from their experiences? My name is Lisa Meeks, and I'm thrilled to bring you the Docs with Disabilities podcast. Join me as I interview docs, nurses, psychologists, OTs, PTs, pharmacists, dentists, and the list goes on. I'll also be interviewing the researchers and policymakers that ensure medicine remains an equal opportunity profession.
Hello and welcome back to the Docs with Disabilities podcast. Today we are joined by two very special guests, Dr. Raffi Najarian and Dr. Justin Ramsey. Trained as clinicians in physical medicine and rehabilitation, Dr. Najarian and Dr. Ramsey both have intimate knowledge about disability through psychological, social, and clinical lenses. In this episode, we discuss the world of physical medicine and rehab, what it looks like to navigate medical education with a visible disability, and the internal and external struggles surrounding accommodations for disabled trainees. We begin with an introduction by Dr. Najarian.
So I am Raffi Najarian. If you see my name in print, I am also Christopher. Go by my middle name, and there's a number of people in my family that go by their middle name. So I just figured, why not me too? I am a pediatric physiatrist in Ohio, and I've been at it now for 10 years. I have cerebral palsy, diplegic. I use a wheelchair in my work life, and more as I age in other parts of my life outside of work as well. I would say that my CP does not define me. That sounds cliche, doesn't it? I do lots of other things. I play wheelchair rugby. I love to cook. I have a beautiful family, a wife, and two stepdaughters, and the goofiest dog you could imagine. Which is to say, I've got a pretty great thing going right now. And to be here with both of you is really exciting. I think, as I told you, Lisa, when we met, I've never podcasted before, either to generate a podcast and interview people or be interviewed. So this is really cool.
Justin?
My name is Justin Ramsey. I'm also a pediatric rehabilitation physician. I have CP as well. I have hemiparetic CP, which means that one side of my body is affected. I walk with an AFO or a leg brace, and I have some trouble controlling a hand. CP does not define me. I heard a wise person say that somewhere. I used to enjoy cooking in like fire pits. Now I have two small children. That hobby has gone away temporarily, I hope. My current hobbies include learning about Sonic characters, playing the Nintendo Switch, and I'm also a makeup model during the evenings for my daughter. So
That's so fun. I love it. And you're located where?
I'm an original Kansan. There's the Kansas pride coming through, but I'm practice in Oklahoma City at a private rehabilitation hospital.
Awesome. There was something really special about the way the two of you interacted, and clearly you've worked together and, dare I say, are friends, it seems like to me from the outside anyway. Can you tell us how you met?
Well, that was a long time ago in a land far away. I think we originally met when I was a brand new attending physician in Iowa. And Raffi, I think you were a fellow in Minnesota.
Yeah, I think that's right, yes.
And so we've known each other for years, but not well. Pediatric rehab's a small community, so if you don't know somebody, I tell people you know somebody that knows them. But then recently, we've been, over the last year, maybe 2 years, we've been working on some projects together. One of which is that article that you're referring to.
Yeah. And how did you originally meet? How did you get connected?
I was trying to think about that because my memory for these things is always terrible. But we probably met at a conference, right, Justin? Like I don't.
I, as I recall, I was the only person in this in Iowa at that time, and so the where you were for fellowship was kind of a big flagship deal, and so I had done a meet and greet sort of with the folks up there, and I had an opportunity to meet you.
Well, see, there you go. Your memory's better than mine. As Justin said, the pediatric rehab community is small, so I always say it seems like everybody knows everybody, and I think that the subset or the sub community of you know disabled pediatric rehab physicians tends to know each other pretty well. But our field is growing. We used to quote, "Oh, there's about 250 board certified pediatric rehab physicians, you know, that exist anywhere. Most of those are in the US." And I think now we're up to 350, I think is the number that I heard most recently. So
Wow.
there's been a lot of growth, even in the last decade, which has been really cool to see.
And you were talking about the group of people that have disabilities that are also in pediatric rehab being more of a small, close-knit group. You share a diagnosis, but I imagine that across, all of pediatric rehab, there are several different types of diagnoses and disability identities that they're carrying. What does having that community mean to you?
It's great. I mean, where else can just sort of share ideas, experiences, successes and frustrations with a group of people who understand what that's like more than anyone else. It's such a shared experience, not just, where we are now and what we're all doing now, but, the journey to get here. Anybody would look at that and say, wow, that's really great that we have that. And I don't know that it exists right anywhere else, but in sort of the pediatric PM&R community. But feel free to hop in on that, Justin.
I think I think it's obvious that within physical medicine and rehabilitation, pediatrics is the best subspecialty. I feel like there's clear objective evidence about that. Joking aside, I think rehab in general is more accessible and there's more interest. And I think that's because rehabilitation physicians, physiatrists, which I kind of cringe saying that because the word confuses everybody, including my own family. Basically, it's a specialty that trains to treat physical disability. And yeah, there's other tracks. There's people that specialize in pain or spine, but the heart of the specialty, even within the adult world, is hey, we're going to center ourselves making physical impairments better. So I would say there's a inbred mindset within the specialty of these people are important. It would be weird to want to match in the specialty if you couldn't easily say that.
So interesting. Well, I'm glad you all found one another. Our research shows that community and being in a place where people with disabilities exist and where people respect disability as well, which it sounds like part of what you're saying, Justin, is that even the physicians that are not disabled that come into PM&R or physiatry are focused on improving physical health, and they have that empathy and understanding and respect for the patient to get them to that place.
In this next section, Dr. Ramsey and Dr. Najarian share with us how their experiences as children with visible physical disabilities led to their eventual careers in medicine.
Let's go back a little bit. And I want to find out more about your experiences growing up. In general, society, and historically for sure, society hasn't
sent a message to children with disabilities that, hey, why don't you be a physician, right? Why don't you be a nurse? Why don't you be a healthcare provider? And I think coupled with that limited view that society has historically had, there has also historically and in current times been the perception that a physician is a superhero, that a physician doesn't need to sleep, that a physician doesn't need to eat, a physician doesn't have any bio needs. When you have these two things together, when you have this societal belief about disability and you have the archetype of a physician being that of a non-needing superhero, it doesn't pave the way for a career in medicine for someone with a disability, especially a physical disability. So I'm so interested in your backgrounds and how you got to a place where you could even apply to medical school.
Having hemiplegia is interesting. When you're little, it's just fitting in. And then sometimes you run into those barriers, not focusing on the stories. I also tell most of my patients that for small children, it's largely small children just being blunt and curious. And you need to know how to roll with that. I'm competitive by nature. So in school I did okay until this program called Book It came out, and then they gave you free pizza if you read the books. And then
Yes.
I read every book in sight for two reasons. I wanted to win, and I really like pizza. And so the competitive nature kind of fueled me to do well in school. I had an orthopedic surgeon that diagnosed me. So he was my doctor from when I was like 2 to probably early adulthood. He was just a kind man. He was regional orthopedic surgeon, didn't have a director of this or that behind his name, but he was kind. He was a fan. And I remember one time in elementary school, I was really struggling. The identity, some physical limitations that occurs when you're trying to keep up. He took time to speak to the school class on my behalf. I wasn't there. I was so nervous I ended up throwing up on the teacher's shoes. um, Dr. Edwards was a key component of enabling me. You have to take care of your ethics, and you have to take care of your morality, and you have to take care of yourself. And so he did some things that allowed me to enter medical school. I also, in college, worked for a Senator for Developmental Disabilities. And when I was young, everybody was processed through there, including myself. Later, it became more of a job training workshop sort of scenario. But these people knew me when I was little. And there was one woman who at the time was probably in her 60s. She was nonverbal and she had a developmental delay. And so she would speak with kind of using her hands and pantomiming. When I started working there, she would hold my hand and pantomime to people that she held me when I was a baby. When I decided to go to medical school, it's because I was competitive. I didn't like being told that I couldn't do something. I wanted to keep up. And if you're going to do well, I'm going to try to do better. They basically were telling me, I want somebody to represent us. They also said, don't you forget us. We need, you're one of us. And we need somebody to represent us, and don't you forget us. And so that's something that I carried with me into medical school and still today.
Oh my gosh. Well, that's wonderful. I know I love that you are now a physician because of your love of pizza. I mean, essentially, when you strip everything away, that was the motivator, right? The
Yeah,
pizza.
I share a lot in common with the Ninja Turtle Michelangelo.
Raffi.
Oh gosh, where do I start after that? That was great, Justin. I have 4 siblings, so 5 kids. I am number 4, so on the younger end of the spectrum, in my family. So I think that I was definitely one of those kids where my parents were like, we're going to treat you like any one of the other kids. So there was like that part of it. They didn't cut me any slack. My mom was such a fierce advocate for me. Looking back now, like I can see that clearly. After I was diagnosed, probably I think around a year of age, she got me into therapies early on, right away. I remember doing physical and occupational therapy all the time. And she took me to every session of therapy. She was always there. She took me to all my doctor's appointments. I had a couple different orthopedic surgeons along the way that took care of me, and both were great. I also had, and I didn't know this at the time, but she was a physiatrist that I saw periodically. So you could say that my exposure to the field started early on. But yeah, mom was there every step of the way. She got me connected to, all the services. I was also lucky too. So growing up where I lived in Michigan at the time, there was an adaptive soccer league, which, in the early 90s, I don't think that really existed very many other places, if at all. And so in my middle school years, 6th through 8th grade, I played on an adaptive soccer team with kids with all other disabilities. I was the goalie on the team. I could not at the time, I didn't walk very well. I didn't take my first independent steps till I was 7 years old. When 11, 12, 13 years old, I was still not a great ambulator. I played goalie for my team on my knees. I would wear knee pads and crawl around. We played with smaller nets, but I was the goalie, and most kids couldn't kick it over my head, which was good. So I could make some saves. But that was a great experience, and my mom found that and got me plugged into that. I also remember that I did horseback riding for a long time. So through the local 4-H program,
Yeah.
there was a horseback riding program for kids with disabilities. And so like every Monday night, in the fall, I would go ride my horse. And the other kids that were there, again, different disabilities, different levels of involvement of disability, and I love that too. And it was my mom, while treating me like all the other kids in our family, also found experiences, for me to participate in that made me feel like I was able to do things like the other kids, my friends. The other thing is, I had a great group of friends growing up that I am still friends with today. 3 other boys at the time, and we've known each other, some of that group of 4, since kindergarten. And I don't think they ever looked at me differently because of my CP and my difference in mobility. They just looked at me as like another great kid to hang around with, who was fun and smart. We went everywhere together. I was really fortunate growing up that I had just overall a really positive experience. That combined with the fact that there are multiple other physicians in my family. My dad, he wasn't a physician, he was an orthodontist. But his brother, my uncle, was an orthopedic surgeon. And my older sister, who's about 9 years older than me, is an emergency medicine physician. Medicine was sort of already baked into my family. Never along the way did anybody say that you can't do this. It was sort of expected, from my dad, especially in our family, that you get an education, you get a professional degree, right? So, like, physician, lawyer, that message was, imbued on us all the time growing up. And so once I realized that I probably wasn't good enough to be an artist, right? So that's like what I wanted to do, what I wanted to be growing up, because I was really good at drawing. I especially pencil drawing. I did that all the time. I was pretty good at it. I'd get compliments from, my classmates in art class. Oh, like, you're really good. But somewhere along the way, you realize that most artists struggle, to make ends meet. And so, where do you go from there? And so then I started to look at medicine.
Follow along as Dr. Najarian and Dr. Ramsey describe their experiences as disabled students applying to medical school. Although they both confronted external and internal biases against disabled people, their grit, determination, and good mentorship were key factors in their successful journeys into the field of medicine.
Raffi, I'll stick with you for just a second because it sounds like, this was just kind of course, this is what you're going to do. So you went to undergrad, you did all of your prereqs. Did anyone in the educational system ever have any kind of negative feedback for you about applying? What was your process like for applying? And then on the flip side of that, what was it like interacting with the schools as you were applying? Did you ever fear that you wouldn't get in because of your disability? Which is a lot of questions all at once. But
Sure. And again, you have to remember, Justin, I think your memory is better for things than mine in general. You
Because
know,
I'm younger.
yeah, I'm a little bit younger than you. So I enrolled in medical school 20 years ago. So I was applying in the early 2000s. I'll get to that. As I look back on it now, the application process, I don't remember a lot of barriers to that. The people that I ran into were pretty supportive. I did not apply to a ton of medical schools. So I was a pretty smart guy. I got a pretty good GPA. So from like a numbers standpoint, at the time, I was, I think, probably pretty competitive. If you if you get me to the interview stage, right, in the application process, I think that you will see in talking with me why I'm going to be an important piece of your class. I've always felt like I've never been an eloquent speaker, gotten better in that capacity over time, and certainly with interviews. Interviews are always nerve-wracking, but um, I remember sharing my story in some piece during a lot of interviews and saying, look, even with my CP, my physical disability, look what I've done. Look how successful I've been every step of the way. Just you hope that enough people see that and understand that. It actually took me 2 tries to get into medical school. So the first time around, I don't think I got any interviews. And it's hard for me to say, and I don't think I thought at the time that it was because I was disabled. What I remember at least one school saying was, well, apply again, show us that you can do graduate level work. Looking back at it now, I don't really know why that was such a concern. I was a chemistry major at University of Michigan. I had like a 3.5 GPA overall, and as a chemistry major at Michigan, and so and I do think that that particular institution carries a lot of weight. And I hope still does. I think it does. But for whatever reason, and you don't know the minds of the people, making decisions at the admissions committee table, whether or not any, biases came into play. But that message of, show us that you can do graduate level work was what I heard from at least one institution. So I was sort of like, well, what do I do now? And so I went back and said, okay, I'm going to do some graduate level work. So I applied to the School of Public Health at Michigan, got accepted, got a full tuition scholarship, and was very successful in my 2-year master's. And I reapplied to medical school got interviews this time. And again, speaking to my point of give me an interview, and I think you'll see that I'm a valuable piece of your class. Now that I had interviews, I think people were able to see that. The place that I ended up attending medical school, which I guess I'll say because I overall had a great experience at Wayne State University in Detroit. I got in off the wait list. I feel very lucky. I needed some help and I had to work hard. And while it took me a couple of tries, I was successful and and continued to be, but not without some trials and tribulations that we'll get to. Yeah.
Justin, what was your path like?
Well, I had that physician mentor before I knew I was interested, and he helped me shadow him. I don't come from a physician oriented family. I come from a farming family, so I'm most comfortable sitting on a hay bale feeding cows alfalfa. And if you don't know, that's like their candy. Um, there were some challenges I faced, but I was doing well academically. I was competitive, and so I had an interest in medical school. Some of those experiences in college working with individuals made me interested. And I got into my state medical school at my first try. There were some barriers I ran into once in medical school. But
Mm,
as far as the application process, I think a lot of the proposed barriers that I was worried about were internal, were self
mm,
driven. So, concerns of fatigue. One of the advantages of having CP, or I think another developmental physical disability, is your illusions of being a bulletproof Superman are kind of taken away at a very young age. And so you're aware of, hey, I'm not Superman. Can I handle this? I don't know that I can. And and I wasn't talking about academically, I was talking about the physical drain. I was talking about the technical standards specific to my case, stitching, for example. I think that the technical standards questions, which I struggled with, and at the time, I think in part because of my age, but I still think it's a current question that medical schools face. It's like, well, what does he need to do? And so I don't stitch in my current profession, but those were the internal barriers and questions, and some self doubt was a barrier, despite doing fairly well academically.
So you say that you had some barriers once you were in medical school. Let's expand on that a little.
Sure. Well, I would say a typical experience for a medical student is that those first 2 years are largely academic, right? With some clinical experiences, some limited clinical experiences. And so the first 2 years was just largely dealing with more volume, right? More volume of information. And I was able to keep up with that and be competitive. I was in the middle of my class. And then the third year came around, and that's where my anxiety came to play. And I think most of my experiences were great with individuals. I remember during my surgical, I brought up suturing as a concern. I remember on my surgical rotation, and talking about stereotypes, there was an intern that went on to become a plastic surgeon, but he spent the nights on call. There was fake skin, and he would spend hours with me when we weren't seeing patients, helping me throw a stitch. And I will remain
Mm,
forever grateful for him. But I ran into actually a non surgical specialty where there was a attending that had a reputation of make it or break it. I had a accommodation of, Dr. Ramsey wears a brace. He might ask for additional time to set down during rounds. And the hospital is very appropriate in making that accommodation. But this individual had a reputation of picking somebody that he considered weak and grinding them down. That was a reputation that was beyond disability. It wasn't just for disability. He was known for picking the individual and grinding them down, disabled or not. There was a lot of people that responded to it of, well, he made me stronger and better. And that's certainly a way to respond, to be fair. If you knew the physical layout of the hospital, he would basically take the longest routes in rounding as physically possible. And then if you ever made a mistake, he was extremely critical. And I internalized that. And so some of what I'm saying was reflective of my maturity at the time, probably, in that, it's important to respond to criticism, right? But it's also important not to allow somebody to control your self-image or your thermostat. And so in part because of anxiety, I was convinced that I couldn't do it. I was convinced that I needed to quit. My family has been wonderful, supportive, but they're not wealthy. And so I was like, oh, I have all this debt now, and how am I supposed to pay it? And I remember a weekend in which I just was quite despondent and considering how I was going to quit medicine. And I went to the disability and inclusion officer, and she actually referred me to the chief of physical medicine. Not every training hospital has a physical medicine residency, but I was fortunate enough that mine did. And he took me, listened to me, examined me, and told me that not only could I make it, but he found the specialty for me. And again, I don't think, I'm not wanting to imply that physical medicine physicians need to be more specialized to disability. I think that needs to be very case and specific, but he saw my heart, my interest, and helped me from a point where I was about ready to quit to being very successful. And 90% of my experience was positive with very kind people, including, surgeon residents that helped me throw sutures. I remember when I was an intern, I did a transitional year, which is multiple specialties, and the surgery attending made me attend the OR because I always was trying to take care of the floor medical complications. The senior residents loved me because they got to be in the OR all the time, but he forced me to be in the OR with them and made me learn. And most of my experience was great, but there were challenges, some of which were internal.
So, Raffi, how about you? What was your experience like once you got to medical school?
So, Justin talked about the worrying about the fatigue factor. That was something that I was worried about too, and I think pretty aware of. And so, prior to medical school, I walked everywhere. So I wear leg braces, ankle foot orthoses, and I also use forearm crutches. And so prior to medical school, even like all throughout undergrad, I think I knew that medical school was a different beast. And so I transitioned to using my wheelchair the majority of the time. Like Justin said, the first couple of years of medical school, typically it's mostly classroom work. And so you don't have to worry a whole lot in terms of physical tasks or capabilities. But one of the things that came up right away, of course, is anatomy lab. And that started from day one. And so, how do you do that, right? So you're down there in the anatomy lab, and all of these cadavers are on tables that are, like table height, right? And I'm sitting like a counter height table. And so I'm sitting in my wheelchair. How do you get up there? How do you see anything that's going on? How do you do any dissection? I'm pretty good at transferring in and out of my wheelchair. So, I would just sit on a stool at the side of the, table that the cadaver's on so I could be up there and participate. But then comes the the testing period, right? So our exams in anatomy lab were practicums, and I'm sure that this still happens today in medical school, although they probably don't work so much with full cadavers anymore. But you'd go around the cadaver lab, and everything was timed, and things would be marked on the body, and you'd have to answer questions about whatever they were pointing at. So how was I going to do that under time constraints? You know, like everybody else, right? I move more slowly when I'm on my crutches and just getting from one table to the next. So there was some work to do with the the administration about how we were going to make that happen, how we were going to accommodate me. And I am very appreciative that they were willing to work with me to figure it out. So basically, what we did is our class counselor was my sort of aide for the test. He would walk around with me, and I would tell him the answer, and he would bubble it in for me. And so that's how we did it. Um, and I'm very appreciative for everybody at the time who helped to make that work, and that they found that acceptable. And that was probably the biggest hurdle in the first couple years of medical school. But then you get to, as Justin said, your clinical rotations. And again, very similarly, my concern was surgical rotations. I knew that I did not want to go into surgery. I was very nervous and anxious about suturing. My my left hand doesn't work great. I do have some weakness and coordination problems with my left hand. And so suturing similarly was very anxiety provoking. I did spend as much time as I could practicing, similar to Justin. And I ended up doing some suturing. Ultimately, the majority of people involved in my surgical rotations felt like if I knew, what they're trying to teach, if I knew the material, and I could show some rudimentary stitching technique, that was good enough. But generally, I tried to avoid situations in which I had to suture because it was difficult. I was slow. Didn't look great. There were definitely surgical attendings that were harder to deal with, but that wasn't directed at me specifically because of my disability. I think that was everybody, every student that was on the rotation at the time, with those particular people.
I think that is the harm of this perception that doctors are super people. How it harmed me is basically looked at my own internal biases, doubts, ableism, if you will, and it affirmed a "you're not good enough" component. I I think there's a question in most with disabilities, particularly physical disabilities, of I'm not good enough, and so the harm, whether or not the message is portrayed that way, is that can be affirmed. And
Mhm.
like I said earlier, it reflected on my own internal thing. You should take criticism and you should reflect on that criticism and look how you improve. That is a healthy, normal thing that we should all engage in. But allowing a person external to yourself to control your self-image, your self-value, no matter who it is, whether in a romantic relationship or professional relationship, that is unhealthy. Yeah.
Raffi, I feel like we're getting some good marriage and parenting advice right now too. Like not just patient advice, but some good advice in general. And I agree with you. I mean, the amount of feedback we give in medicine is not translated into other professions. It's so interesting to me. I do think feedback is incredibly important, but then it sets you up if the feedback is coming from a place of bias or coming from a place of intentional harm or mistreatment from a preceptor or attending, a learner may internalize things that are not true.
Yeah. And to be fair, I have certainly said things that I have wished that I hadn't, and probably guilty to some degree of harming a person's self image. And I think at some point everybody has had examples where maybe they've been hurt, and I think there's also examples where if you're being fair, you could have done it better, you could have said it better, and that's part of the learning process.
I'm so grateful to be in medicine because it is one of the most important skills, because you can always improve. The harmful feedback that's intended to be harmful and belittle someone is not helpful and can be damaging.
Physical medicine doctors serve an incredibly important role on the healthcare team, managing both acute and chronic physical disabilities with a focus on function and quality of life. In this next segment, Dr. Najarian and Dr. Ramsey share about how they chose to specialize in this growing field.
One of the deans was PM&R trained. That was her background. And so that's how, at some point, somebody, said, you should talk to her. Most medical students don't know what PM&R is unless they are fortunate enough to find their way to it. I was lucky enough to have as my first exposure to PM&R, because after learning about it, I wanted to find out more. My first rotation was as a third-year medical student in pediatric PM&R at the Children's Hospital there in Detroit. As Justin kind of intimated earlier, Pete's rehab folks are just the best people around. It doesn't matter where they are, what they're doing. And so I had just a fantastic rotation with the crew there. And those are people that I still know today. But I knew after that rotation that was absolutely what I wanted to do. And I think sort of merging that with like my own experiences as a patient with CP, right? So like the positive experiences that I had growing up working with great therapists and like the physiatrists that I had, that I didn't know I had, right? And the orthopedic surgeons that I worked with that took care of kids like me. Like I wanted to turn around and be able to do that for kids that were like me, right?
Yeah.
I
Yeah.
overall had such a positive experience that I wanted to give that back out into the world. There's a couple different routes to pediatric PM&R. I did an adult PM&R residency followed by a fellowship, and so I was waiting for any of my other experiences during residency, taking care of adults, to sort of capture my heart in the same way that pediatrics did, and nothing ever did. But I think that's just my makeup. I grew up around kids. I had a ton of cousins that I was around all the time in my personal, and I found out in my professional life they're wonderful to work with. I found much more personal and professional satisfaction working with kids than working with adults. And so there wasn't anything else along the way that steered me in a different direction. I wasn't interested in doing a lot of the things that are very popular in physical medicine, which are things like sports and spine and doing a lot of procedural injections for chronic back pain, right? It
Yeah.
just wasn't interesting to me in the way that this crazy world that Justin and I are in, where like every day is different, right? Like the way my work is now, no 2 days are exactly the same. And a pediatric physiatrist can do and does most days so many different things in each workday that keeps it exciting and just really enriching, and I can't imagine myself doing anything else, at this point.
Justin?
Within my third year of medical school, I was exposed to physiatry. I enjoyed the adult components, not necessarily the chronic pain stuff that Raffi alluded to, but the inpatient component of adult rehab. I enjoyed quite a bit. And then I just ran into the kids, and I I like kids. Braces are an interesting conversation in our field, for example. So you will hit a point where a patient can walk and they benefit from a brace, and then it's almost predictable, not universal because people are different, but yeah, I'm not going to wear that brace. Why? Does it hurt? Does it, is it causing a sore? And Rafi's shaking his head because he already knows what I'm going to say. It's because, no, I don't want to be seen with a brace.
Yeah.
And you could call that ableism or self-doubt or just the natural human desire to want to fit in.
Yes.
And so I will joke with families that a patient once fired me because I suggested that he wore really heavy cowboy boots and that wasn't the best footwear for him. There's that identity of, I'm tired of this. I'm tired of dealing with this, and I don't want to be identified this way. And so I like connecting with kids on that level. Some of my partners, past and present, who are very good, and if they have a patient that is, struggling with that identity issue, sometimes they have me see them once because they know I have developed a willingness to share my story if it seems appropriate. And if it seems appropriate is the key statement there, because there's times when it's not. And it's about them.
Yeah, I would agree with that, Justin. Sometimes you have to read the room and know when the time is right to share that sort of personal slant on a particular issue. So one of the things I love doing is, and it's almost always universal surprise, when I roll up my pant leg and show my braces off to a patient, right? And they're like, "What? Like, you wear braces too?" But like, and I get that a lot too with the wheelchair. Like, "Oh, like, why are you in a wheelchair?" And I'll be like, "Oh, I have CP." And their parent will say, "Oh, see, he has CP just like you do." And it's like this really wonderful moment where maybe I'm the first adult or person in general they ever met that has what they have, right? And they start to see that people with CP are out here in the world doing things. Maybe they can think about doing things like this too. Their parents will tell them that, say, "Look, Dr. Najarian's a doctor. You could be a doctor too." Even if it's not a conscious thing that ultimately they end up thinking about, they've seen now, they're seeing it even on an unconscious level, that we're out here participating and doing good things in life. That is the most rewarding part of the job. At the same time, I still bristle when people use the word inspiration. I think we all do a little bit, because, like, I'm just here living my life, right? Just like we all are. I have different things that I need to do, that I do every day, that other people maybe can't imagine doing in their life. But to me, it's just my life. It's not anything special or exceptional. I'm not here to be your inspiration, in that way, but in the more positive light that I just spoke about. So
Absolutely.
Wow, what Rafi's inspiring me to say is
go for it. Go for it, Justin.
is across disability, and you'll hear it, and it's meant in a positive way. You're an inspiration. Talk about CP, they might talk about Down syndrome. Well, those people are so sweet. They're such a wonderful group of people. And sometimes I make a purpose of saying, yeah, there's a lot of those. I've also met some really big a-holes.
Yeah.
and so and I make a purpose of saying, hey, people with those conditions, they get to have the full experience of human personality types, flaws as everybody else. And so I think that's a good point. Raffi also made a point about visibility. When I'm in my middle 40s, there was a visibility issue of representation at the table within medicine matters. It matters because of just subjects of health policy. We've discussed COVID and kind of that urgent ventilator allotment policy that states had, some of which may have been biased against individuals with both developmental and physical disabilities. But that visibility is important. And I think there's clear evidence that diversity in general helps workplaces and helps the field of medicine. And I think there's experiences that we bring that others bring with different impairments that add to the diversity. And getting away from uh, this historic cult, if you will, of physicians are perfect in nearly every way, perhaps it's more important to focus about them being human and suffering or having challenges sometimes helps one be more human.
With many years of wisdom under their belts, Dr. Najarian and Dr. Ramsey pass along their advice to the next generation of disabled students.
I know there are a lot of students applying this year who have CP. There'll be a lot of students with CP listening. And so we ask our interviewees to give advice to the listener. While we're growing by leaps and bounds, the numbers of physicians with disabilities are still quite small at 3.1%. So, in many cases, your voices, your story will be the only source of mentoring for someone coming in. So what words of wisdom would you have? What advice would you give to people looking to enter medicine?
But I think most people out there, and this includes people that you will interact with in medical schools, admissions people, people who are going to hopefully interview you to be in their class, that they want to help. They want to help you to be successful, by and large, right? I mean, there's always going to be people that have unfair assumptions about what we can and can't do. But I think when you get to that point where you've otherwise shown that you are intelligent and dynamic and thoughtful and somebody who's going to bring value to that medical school, that those people in administration want to help you. So if you're somebody with CP, where you can't really hide your disability, right? It's out there in the open, it's out there in the world. Disclose, you know? Let them know, like, this is me, this is who I am, these are my challenges, but this is how I've been successful. This is how I think I can continue to be successful. Work with me. Let's figure this out. Let's figure out what I need to get there. And I think most of those people that are in those decision-making capacities want to do that. But at the same time, I think that schools need to follow through in that. They need to figure out that we, as applicants, right, need to be able to trust you, that we're not going to be unfairly pegged and taken down or discriminated against. It's not where we need it to be. It's not where we want it to be. It's a long road. It's like a snail's pace, right? But I think that's how change happens. But I think we have to be willing to say, hey, here I am. This is me. This is my disability. I need help. And it's part of building that more sort of interconnected, supportive, loving community of medicine. I realize that maybe that takes some faith on the applicant's part. But I think that you have to be willing to put yourself out there. And if there are bumps in the road, trust that you can work through them.
I think well, we're working on with other groups of individuals on mentoring initiatives. I know you've kind of worked on your own mentoring initiative as well. I think it's important to understand that most people involved in healthcare training are well intended, the vast majority of those, but no one knows everything. And so, what I tell my students, what I tell my patients is we all teach, all of us teach everyone else about us and how to relate to us. So, you have to be a good teacher about yourself. I think the biggest fear that anybody with a disability has had, if I was going to generalize, and either of you can feel free to disagree with me, is there's a fear of playing the victim card, right? I I don't want to be seen as using a crutch. I don't want to be seen as a victim. If I voice this concern, they'll think I'm whiny. I guarantee you, as we went through our training, as our counterparts went through our training, we've all had a question, Raffi, others, of, well, should I talk about that or should I just not? And there's a balance. Don't want to embrace a victim mentality, but you do want to be confident and have value. And there's people that can help you articulate that. And many of those don't have a disability, or if they do, it's maybe not your form of disability. I often think about some of the greatest barriers and people that I've faced in my life. The greatest barrier I had to getting to the next step was most often me and my fear. Understand that you have value and have a good sense of self-worth. I think that's what medical schools are asking for all their applicants is, who are you? Do you know yourself? And do you have the confidence to deal with a multitude of challenges? And medicine is a difficult field. There's not only physically challenging things, but very sad things that you get exposed to. So there has to be some level of resilience there. But I think know yourself, understand that you might be your own worst enemy, and have the confidence to articulate a need that I think most of us are still trying to figure out. I'll be trying to figure it out, hopefully, 10 years from now.
You're both wonderful. I knew you would be. You're so authentic. I think your advice is so spot on. And I don't think anyone has ever brought up those things before on the podcast. So extraordinarily valuable. I love what you're doing. And I really enjoyed this talk. I appreciate you both coming on.
Well, we appreciate the work that you're doing. So thank you. And thank you
Thank
for
you,
inviting
Lisa.
us.
We need more people like you out there doing the good work to advocate for the disability community as well.
Well,
So
thank
thank
you.
you.
It's an honor.
We'd like to offer a special thanks to Dr. Najarian and Dr. Ramsey for generously sharing their experiences as disabled clinicians who work with disabled patient populations. Their experiences as children, students, and trainees informs their work and advocacy today. To our audience, a sincere thank you for joining us in this episode. We invite you to subscribe to our podcast and look forward to having you tune in again. This podcast is a creation of the Docs with Disabilities initiative, supported in part from the University of Michigan Medical School Department of Family Medicine M-Disability Initiative, the Stanford Medicine Alliance for Disability Inclusion and Equity, and the Ford Foundation. The views expressed in this podcast do not necessarily represent those of the hosts, their respective institutions, or the sponsors. Released under a Creative Commons Attribution, Non-Commercial, Non-Derivative license, this episode was produced by Lisa Meeks and Gabe Abrams with the valuable assistance of our audio editor, Jacob Thiemann.